Well, good morning, everyone. Buenos dias. Well, it's a great pleasure to be here with all of you and at this amazing conference and to share what I have learned, my experiences in the many things that I have served, committees, advisory committees, boards, and not all have been in the nursing profession. And also, they haven't just been as a professional nurse, but during my formative years. Just tell you why it's been so important for my involvement, to get involved in the things that I do, and the things that I believe I bring to the table, and not just as a registered nurse, but also as a Latina registered nurse, and as an immigrant to this great nation and state. I want to thank the Oregon Center for Nursing for this invitation and for bringing excellent speakers to this conference, and also for doing such an excellent job in being the connector for nursing in Oregon. By the way, I'm a member of this board, and we do have an outstanding board, incredible members, a board of directors, and the best team that we could have. Jana, Kelly, Kate, and Richard. So that really makes the difference on the work that we do on a daily basis at OCN. And then also to tell you, just putting in action the things that we have learned. The first speaker, Jennifer, did a great job in giving us that very high level. And my job is just to tell you what I have done, to put some things that we discussed in practice. And so what I would like to ask you is I would like to know who is in a board. Raise your hand at this particular moment. Okay, very good. On a board, board member. Or a committee, any sort of committee. Okay, which ones are health related? Not health related. Very good. Very good representation. That's great. Really, really good. So I'm going to go down. So I'm going to tell you about my story. It's been, when Jana called me and asked me if I would consider to be a speaker today, I was just like, yeah, I will do it. So I'm just, start thinking about, my story, my personal story. I migrated to the U.S. when I was 18 years old. I got married quite young. I've been married to the same man for 40 years this year. And so now you know how old I am. And I look back at the things that I've done. I have a lot of family influence in the things that I do today. And the one person that I think back, thinking about everything, where I have been, where I want to go. Still, I'm very interested in getting into other boards and doing other things, not just at the local level, but also at the national level. I think of my grandmother. My grandmother, Pura, my mom's mother, was an amazing influence on me. And she was a woman who, again, influenced my passion for community and who left a very deep footprint on my heart and on also helped to shape who I am today. My grandma was a revolutionary. She truly was. She was an amazing woman that got to study to 6th grade. However, she had a great passion for the radio, for the newspaper, and we listened to the radio at our house 24/7. We did not have a television set. My first television set came to our house when I was 12 years old. So we just learned to read the newspaper and listen to the radio. And I was born and raised in Costa Rica. So my grandma was really involved in the 1948 revolution of my native country, where she got involved in the rights for women to vote, for education, and for the democracy that country is today. And one of the things that she always tells us is because she always wanted to study. That was the things that she used to say to us all the time. But she wanted to be sure that her granddaughters went to school and became professionals. That was a passion of hers, and she always told us that was our job. And I have to say that I'm very fortunate that that was my case. That in my house, I was raised by a single mother and a very strong grandmother, two very strong women who have really made a big difference. And all of us went into school and did different things. And most of my sister and I both in healthcare. My brother is in business. The other influence when I think about this with my grandma, all the things that she did, and she wanted us to continue. And she was really into politics. I come from a very political family, and whoever knows me well, you know that I'm quite political too. So that comes from that influence. I remember as a little girl going into political campaigns, going and rally people to go to vote and register to vote. Being with the candidate that was running for president, because my grandma was very involved at the local level. And then there was my dad, and he also got into politics, and he was the mayor of the little town where I grew up, and he did a lot of things to bring a lot of economy to that part of Costa Rica. So going back, when I was in high school, I had the fortunate, very lucky to get involved with a group from the Peace Corps. And I met a phenomenal woman who was from New York, and she just happened to be in public health, and she was from Puerto Rico, and she was a big influence in our high school. She used to take us out to different places and really instill in us, again, why being in the community is so important. And then, just coming here to the U.S., going to school here as a young bride, going to Seattle, learning a new language, and then moving to Anchorage, Alaska, where I went to nursing school. And that was quite a shock. But it was great because I had to grow really fast and really immerse myself in the culture of the United States. And also, I know that I needed to go to school, and I knew what I wanted to be. So just learning the language and challenging myself and challenging my school to get admitted into nursing school. I was denied the first time for a good reason. My language was not ready. I'm still very conscientious the way I speak, so don't be alarmed if you hear something that I may say incorrect. But that was good reason for not getting in the first time, but I got on the second try. And here I am, 35 years later, or something like that. So it's been a great experience, and the challenges and the barriers have been a few, but again, you never give up, and you continue on your passion and your beliefs, and you plant a little seed and you let it grow, and you continue to go by those things that you learn as growing up. Then with boards, as I say, I was also very involved in high school government. I was really involved with healthcare. I got involved in the Red Cross when I was in elementary school and high school. I was in the Red Cross Club, and I used to wear a little hat with a Red Cross in front. So because I was in the safety committee of the school, so if anybody fell, scrape, we were to go and help that person. So it's been really interesting to think about those things. And then, youth organizations. When I moved to Anchorage, Alaska, I started working for a youth organization there, a Native association, working with teenagers, kids, 13-year-olds that were pregnant, and I just couldn't understand that. And just to try to, help those young people and to make sure that they will stay in school and continue with school, and helping those very young mothers that they were children themselves. And then, just also with involvement that I continue as a parent, all the routine, Boy Scouts. Oh my God, I've been a den parent. My husband was the scout leader. I was a den mother for years and years and years. To see him now, I see those men, because now they're men. And I remember when they were little, and I say, oh my God, I'm so glad that you turned out to be such a great young man. Those are all my children's friends that I see them now. They're adults, parents themselves, and it's just a great thing just to see that circle back. And so that was one of my first involvement in things, outside nursing, and then committees early on in my nursing career. Different things in the hospital at the local level, and then just continue on different community-related activities, and just that desire to really get involved, to really see what's happening in our community. There's so much going on. And definitely, there is, you plant those seeds, as I said, you get involved, you get to know people, and you begin to build on that network, and one thing leads to another. And one of the things that I really would like to do, and I've been talking to my children about this, for them to also to get involved. I have a young man that is not too far from here, and he now has his own business, and it's just kind of encouraging, you need to get involved, you need to get to know people, and he's doing that. And then I have a wonderful nephew who is in Toronto, and he's already in his second board for youth housing. And it's just wonderful just to talk to him and see what he's doing and where he's going to go. So that's pretty much, my story, that how things have evolved from wonderful people that I have come across. But the person who really paved the way was my grandmother. So that she's in here. So as I have continued to grow on these things, one of my early careers is my early involvement with in a board committee. It's always has been being invited to be either an advisor or to be in a committee of some sort. This graph, it was given to me, God, it's been probably about 20 years ago, that it was provided on a retreat that I went for a board. And I just to take a look at it, it's still so relevant today. It has not changed. It's still really, really relevant, that path that you get involved in, how you do that, the path to board service. And I continue to find this information very helpful, and I share it with others and people that I mentor, and my own staff, that I encourage them also to be involved in committees and in boards, because that's the way that you, as a registered nurse, you need to know what's happening in your community. And being in a committee or board advisory committee, that's led you to that. It helps with that. And I also know that, these experiences, when you start, with the people that is how you get linked into other things. I mean, I take a look at these in this room, and I've known so many of you for so long, and just to see the connections that you have helped me make in my career. I look at Tom, public health. I mean, it's been a great connection. I mean, Jana, OCN, Molly, also for a long time. So it's just, you just start making those, those different connections, and those are the people that and how that continue to expand, and then you have those supporters, because you go and provide information, or you ask. I am a type of person that, I have to say, if I see something that really interests me, I go and start inquire about it, and I look and find out and see who is involved and how, and then if I'm not invited, I try to get invited because it's important. It's important. I mean, it's just, if it's something that really matters in your community and you see that your voice, either as a representative of the minority community or a representative of healthcare, particular nursing, if you don't see that representation on those things, you have to make it happen. I mean, that's my belief. That's what I tell the nursing students that I mentor. You have to make it happen. You have to get involved. You cannot just get involved if you're only sitting behind your desk in your office. It's not going to happen. Things are not going to come to you. I mean, it's just like healthcare. I mean, that's what I do on a daily basis. If we wait for people to come to our facilities, they will come when they're too sick. We have to go out in the community and making sure how they are and finding out, and then you bring those services to the communities, particularly for the most vulnerable members. So it's kind of the same thing a little bit. So, and it's just, like, again, it's just the supporters, and how you start building the steps to go to different places. And, and one thing leads to another. Once, you get the supporters, you get invited, you get, to be an advisor. And being an advisor, I like that because you really get to know that agency. You really get to know who the people are, who the board members are, what's their mission, what's their vision. And that's where you will make a decision whether, you want to pursue to be in that board or not. So just getting, to be at that level, because you're seeing it at a different level, and the same thing with a committee. I mean, how many of you have been invited to be in a committee? Raise your hands. Right? Every single one of us. So that also allows us to decide whether, okay, I would really would love to be in OCN. Oh my God. I've been talking, I would really love to be a board member of OCN. How do I make this possible? Thank you, Jana. So anyway, so those are the things that you ask, that at least I ask myself, how do I get there? And we see that in the schools, and I see that in the schools of nursing with the students. I mean, there's so many committees that you have that within the School of Nursing, and just encouraging people to get involved in our own facilities. We have so many different committees in our own facilities, and many times, it's the same people. We say, oh my God, we are the same people. So how do we make these a little bit different? How do we bring other individuals that we identify? And so again, those are the people that you know and that you encourage and that you mentor to bring him in. So the other thing too that I've been thinking also, and this is something that I've been through my years of boards and committees and what have you, is, okay, what are my strategies really? What is it that I want to accomplish, and what is it that I want to bring out to the boards that I bring? And again, it's just, the access as a professional, that we have a lot to give, that we have a lot to share, and that I want to give. I truly believe that I want to give to my community. I really want to provide my 2 little cents, leave my little grain of sand, add to that little grain of sand to the community based on my profession, my knowledge, and my experience. And how do I align? I am, I do want to align with those agencies or those missions that I truly care about. With groups and organizations, and just again to leave the community a better place, because that's what we want. We want for the kids to have a better school system than the one we have. That's one example. I mean, I want to be sure that one of the organizations that I help fund here in Oregon, the Oregon Healthcare Interpreters and the Oregon Latino Health Coalition, that those are solid, that they have, good foundation and good roots to continue building on. And just to see that those organizations have really solidified is very rewarding. And then, and how to integrate, just to be consistent, to provide that feedback, and just to, amplify the impact that as nurses we bring to the community, from the bedside to the community. That's what I believe, and just to create a good network of key stakeholders, and to build collaboration, because all of this, that's what we're doing when we are in boards. We're building collaborations with other leaders, and we create foundations for long-lasting change. And we talked about system change, and I think that's what we do when we get involved in boards. And then the different roles, that are presented, and that when one is in a board, it can be very rewarding, and it brings great experiences, and it makes us grow and become better nurses and better leaders. So this is my community action, what I call my path, the things that I'm really passionate about, anything that has to do with, social justice, with social determinants of health, education from K to 12, health policy, things, women's healthcare issues, the Healthcare Act. My goodness, we can sit here all day and talk about the American Care Act and what is happening right now, and how it's so important for us to lend our voice and our opinion on what is happening. And this is the reason why I get involved, is because this is where my heart is. And just to, and to provide, as I say before, information based on my culture and my community knowledge. And to, just to bring, different opinions and to this. When I take a look at the organizations that I have got involved, and the things that we bring, and is so important. I mean, as I say, I take a look at the Oregon. One example I can give you is the Oregon Latino Health Coalition. I mean, we started that over 20 years, no, not 20 years ago, in early, almost, my God, time goes super fast. Yeah, I guess almost 20 years ago. My goodness. And we started with the prenatal expansion. That was one of the things that we wanted to be sure, is that we had a prenatal expansion in the state of Oregon. It took us a long time to get there, but we finally did. And so that was just a collaboration of many other Latino stakeholders. And now that association, the Oregon Latino Health Coalition, now has its first executive director, and they're in different campaigns for Cover All Children and other things that has been remarkable, the work that they have done. The other one that I'm very was really great to serve for several years was in the Northwest Health Foundation. I mean, I was one of the advisors for the Kaiser Permanent Fund, the first advisor for that particular fund, and just to think about all the funds that have gone out into the community and all the good that those funds have done is great, including a lot of things in nursing. The Susan G. Komen also has provided so much things for women's health and breast cancer, and now they have a very specific Latina-oriented advisory committee and program. And then there's the other things, with education and communication. I mean, at one time, I wanted to be a reporter. That's what I wanted to do. I wanted to go in media. It did not become a reality, but I have used some of those things that I learned as I was looking into the nursing career, and to communicate those things to the people that I surround with, or those who are around me. The other thing too that I care a great deal is about education, just from public education to K-12, and also nursing nursing education. And I know that in our state we have done a better job in really in the diversity and admission of students of color in our schools, and that makes us even better. And so so those are the things that I think that I bring to the table is, from the Latina perspective, is bringing that perspective into the action of the different committees and boards. And then too is when we talk about like the public domain of communication. I mean, I was a board member of the Oregon Public Broadcast, OPB, for a few years, and I loved that board. It was really good to find out and to learn how all that is communicated and who you bring to the table and how that communication can be broadcast throughout the state. So that was good. And then of course, the Oregon Center for Nursing, which is remarkable, the work that we have done. But when we talk about the passion that one brings, I mean, I'm a board member of Community Action of Washington County, and we deal a lot with poverty in that particular organization, and just really learning, what is happening in our county when it comes to poverty level and how that affects everything that we do. And so in healthcare, we need to know that. We need to know who is in our community, like I said, and I'm singing to the choir in here, is to know what is the poverty level in our community, how is that affecting the children, and how a hospital can get really involved with that and make a difference. And not just the hospital, but us as nurses, because we know our patients really well. And so just try, again, continue to get involved. So my community action, again, has been really centered on public health and community outreach. And I see now the benefits that a lot of that involvement have brought. Before, I think it was Jennifer who said before she left about, when one said, I'm going to get into a board, it's true that we have to really take into consideration the time and commitment that we bring, because it's time consuming. And so you have to be very conscientious of that. I am fortunate now that my kids are grown up, so it's a little more flexible. But I think definitely you have to really pave yourself, and really, once you say yes, is to be sure that you're going to be 110% committed to the work that you're going to be done. Then we talked about also as nurses, why nurses? And I take a look and I think about the people that have mentored me, fellow nurses, people that have influence, and indeed, as nurses, we bring great insights when serving on community boards. I think about the first nurse to hire me, Dr. Geneva Gregg, and interesting enough, she's now here in Oregon, and she's working with the AARP down in Southern Oregon, a wonderful woman. And and I remember after I finished nursing school, and she hired me, that she asked me from the get-go, I want you to be involved in some committees early on. So that was good, because it gets you going as a new nurse, and you don't feel so afraid to say the wrong thing, or you start getting a little more confidence in what's going on inside in the facility. And I also think of one of the professors that I had, Tina Dunlap. She was really very influence on my involvement with different things. And I think of other mentors that I have had, Dr. Maria Elena Ruiz. She's a professor now, and she's at UCLA. And then also I was very fortunate to meet Susan Reinhardt a few years back, and I see her also as a role model, and it's great to see that she's written so much about why nurses on boards and why we have to get involved. And also that, with nurses, taking what we know best is that, when we are involved in different boards, we can really take the pulse of what's happening in the community. We really, in that board, we really, as nurses, we bring a different perspective, as has been mentioned before, about how to best bring that opinion on different issues that are going around. I just had the experience to be in a committee to provide scholarships for nurse students throughout the state, and it was really eye-opener to bring that perspective of the nurse. I was the nurse in the committee, and just to explain why, when you look at the whole gamma of applicants, and there were so many, and then, opinions, well, I like this one because that one, but I say, well, but you need to also take a look at this part, and you also need to take a look at this other part, and let's think about this other piece. So you bring that, and so then you bring a better perspective to that process. And you are really choosing the funds to go to individuals that that are going to be excellent nursing students and future clinicians. So, because again, I think we have a good sense of how to, do an accurate diagnosis and to bring best practices to the things that we do on a daily basis, and to bring those suggestions, transform those things that we know in our nursing practice to the board service. And true, we just, as I think these statements, they're not mine, they're Susan, and I think they really speak volumes right on target of why as nurses need to be on boards and in committees and bring that perspective of healthcare into our nursing knowledge. And so what drives nurses? Why do we care so deeply? And my husband asked me, oh my God, another board? I say, yes, honey, another board. I know seriously, serious. It's because I care, and it's not that I'm involved in everything at once. No, I pace myself, as I said. I have to practice what I preach, and so it's just what drives us, really, because we care deeply about fixing things, but using the analogy that we know when we give medications. Why? Because we want to make sure that we have the right dose, the right time, the right patient, and the right route and the right drug. So it's kind of thing. I see this analogy has really helped me in my nursing nursing practice, has helped me well in committees, because that's when you ask the questions. When something is not clear, you question. And you just don't say yes and vote yes just because. You have to question and you have to challenge. And you have to allow people to, to hear you and to say, okay, tell me that again, or let's discuss some more. Or if you feel some opposition, it's just to continue to talk and provide that perspective that comes from the nursing lens. Just to pay attention, to check things out, and again to questions when things are not clear or does not feel right. And I have that experience in many boards. I have experiences when somebody wants, the decision is being made, and you just raise your hand and say, okay, let's talk about this because X, Y, and Z. So you have to challenge and you have to question. And also, the point on this is that it helps you with the discussion, and it helps you to really come with a better view of the issue at hand, and to make better decisions. I mean, when I think about that the grants that we provided through my years in the Northwest Health Foundation, all the funds are going out to the community, and it's just remarkable, because when you start reading those grants and you start reading what that that agency that is requesting the funds, some are not that strong because they're not making a good case. Just like we have said before, as nurses, we have to make a really good case. And we get challenged all the time in our own facilities, and we have to really make that case, why this is important to us as nurses, as managers of a department. And this is, and a good thing is when it comes to budget. When we are in the budget area, is that we nurses, we have to really work really hard to get the things properly in our budget. So we have to question and push a little bit the envelope sometimes, because we want to be sure that things are done properly. We also talk about, and Jennifer talked about, the diversity, and for me that's very important as well. This is a very, very important point to mention on boards, and particularly in nursing, that we need to think about this diversity, and I'm not talking just race, we're also talking about gender. As mentioned before, our profession is mainly women, but we really need to talk about, bringing others to the table, and people of color and males as much as because we need that, and to have a good minority representation, including people with disabilities, because we need to have that as well. I have a great friend, of mine, his name is Jesse Beeson, and I'm going to be showing you a video here shortly. He works for the Northwest Health Foundation, and he talks about reflected representation. One of the things that I have learned, moving when I came here to the United States, is when I realized that I was a minority. I never knew that in my home country. I mean, I was just who I was. I'm Leda, right? But it's been really interesting on a personal note just to realize that you are a minority, and what that means, and how do you carry yourself when you are considered the minority. And so definitely, and Jesse talks about, that representation matters, and that's really true. Representation does matter. And I think that's where I bring that passion, and probably that's why I'm so involved, because I want to be sure that the Latino lens or the minority lens is represented. And because we have to have that at the table. We need to have those voices at the table. And we need to be able to say, to bring those individuals, to invite those individuals to be on boards and committees to help us do a better job. And Jesse talks about he describes reflected representation as seeing yourself, your experience, your people's experience in the places and positions that matters most in this world. And I think that is definitely, that really resonates with me, because if we're making decisions, let's say, on a board, and we are, let's say that we're talking about, a communities of color. I mean, we have to, as board members, we need to understand. It doesn't matter if you're not a member of that minority community, but as board members, every single board member needs to understand that community. You need to make an effort on understanding, who is in that community and how that community functions. So, and those are the things that I think also lead us to get involved in, in things that, and push ourselves to learn about different communities and different people, because that's how we're going to learn. If you don't go and experience it, we'll never learn it. And so we have to be able to do that. And also, it helps us when we get to know different individuals then that from other communities. They help us recruit board members. And that's one of the things that we're learning right now with the Oregon Healthcare Interpretation Association, is that we are learning, we're doing right now a study on who are the healthcare interpreters in our area. And it's just amazing to see the different communities that we have, and the different needs that we have in our communities. So, and one of the things that I think that I hope that out of this work with that particular association is that, again, bringing the perspective of a healthcare person and being in a hospital is how to work with healthcare interpreters. Because that's one of the things that we struggle. A lot of healthcare providers do not know how to work with a healthcare interpreter. And they're part of the healthcare team. And the things that they bring to help us to do better patient care and do a better customer service is to really know how to work with this particular team of individuals. So, and so for that particular, that I'm learning now on this with the association, is that I'm going to be able to provide better feedback to the people, to the government agencies that are making decisions on healthcare interpretation, and also in healthcare. How do we better use, and how do we go about to better use healthcare interpreters for patient safety and customer service? And I would like to show that video now. I know she told me. I just want to show you the video that Jesse talks about the reflective representation.
I want to start by taking us back to the year 1988. In 1988, I looked like this. In 1988, I was in second grade growing up in Littleton, Colorado. In 1988, in the suburbs of Denver, I could count on one hand the number of black and brown kids in my school, and I'd still have fingers left to pick my second grade nose with. I don't begrudge my childhood at all, and it was isolating. But in 1988, I was also growing up in strange new worlds. I was seeking out new life and new civilizations, and I was boldly going where no one has gone before. Because in 1988, there was this. And thank God, or thank Gene Roddenberry for Star Trek. I needed this place. I needed this place to escape all the burdens and limitations of Littleton, Colorado. Race, class. This was a place where I didn't have to pretend to be a Boy Scout to cover up the fact that I was really a chubby, closeted, gay black boy trying desperately to fit in. Outer space was a place where black folks were engineers, where they spoke Klingon, where they were sought out for their advice. They were valued, they were seen, and they had power. Whoopi Goldberg, like myself, was also a Trekkie. As she tells it, she was 9 years old in 1966 when she first saw Nichelle Nichols play Lieutenant Uhura aboard the USS Enterprise. "Come quick," she shouted. "There's a black lady on TV, and this time she ain't no maid." As she tells it, it was right then and there that she knew she could be anything she wanted to be. And when she got famous, she begged to be on Star Trek: The Next Generation. Star Trek helped me see that representation matters, and I've come to believe deeply that reflective representation, seeing yourself, your experience, your people's experience in the places and positions that matter most in this world, is critical to meaningful civic engagement. Reflective representation inspires the next generation. It gives kids a sense of the possible, a path to follow, a more inclusive future to envision. It's turning on the TV during the Olympics and seeing Simone Manuel take the gold when black folks aren't supposed to swim. Or opening up the local paper and seeing a local profile of our highest ranking Latina judge, Darlene Ortega. Reflective representation also helps erase the unconscious biases that we all have and that fuel our everyday interactions as neighbors and as coworkers. We see black men as deadbeat dads not because the data suggests it. In fact, Black dads are actually more involved with their kids on a daily basis than white dads. But we see them as deadbeats because that's how we're represented. This effect is so powerful that dispelling it is central to the MTV campaign in their racial and gender bias cleanses. But the greatest opportunity for reflective representation comes when we apply it to our very civic fabric, our democracy. We are strongest when our elected leadership reflects the full range of talent and lived experience that I know the Northwest has to offer. But for too long in Portland, we have told ourselves a lie, a belief that we just trot out anytime it's convenient. Portland is just so white. It's not true. But we tell ourselves this over and over, perhaps because we're not living in the same neighborhoods, or attending the same schools, or stepping out of our social circles long enough to see who Portland really is. Some of us are watching Portlandia, while the rest of us know who Portland really is. I say that because this is what the average second grade classroom looks like today in Portland. And this data is a little bit old, so actually we can say for certain that half the kids in our schools today are not white. And even when you add in all of us adults, 1 out of 3 Portlanders is a person of color. 1 out of 3. And so when I hear people say Portland's so white, what I also hear is, I don't see a third of y'all, or a third of y'all don't matter, or maybe a third of y'all have no power. And I guess when you put it like that, it's sort of true. I say that because most of Oregon's elected officials are white, and by most, I mean 93%. And we don't have data on the school boards and city councils, but I'm pretty sure if we did, that number is even more out of whack. We do know that in Portland, there have been just 2 people of color on our city council, ever. This is not reflective representation. And I want to pause to make a brief point. When I talk about a more reflective government, I'm talking about a more reflective experience among our lawmakers that being a person of color, frankly, often means in this country. Put simply, it's not about race, it's about the experience of race. If we are to improve our unacceptable high school graduation rates, or fix our very broken criminal justice system, or make a more open and accountable government, we have to value the lived experience of those that seek to represent us as much as we value their political experience. I look most recently to Baltimore, where despite the outcome, Marilyn Mosby acted swiftly against police violence. Swiftly, where so few district attorneys have. This is in a country where 95% of elected district attorneys are white. 85% of them run unopposed, and just 1% are women of color. 1%. See, Marilyn Mosby knows what it's like to both need the police and fear the police. And we need more elected officials that understand that. We need more elected officials that know what poverty feels like, what the soft bigotry of low expectations in the classroom feels like, what making your kids live among mold and asbestos and lead for fear of eviction feels like. Listen, I know we can do this. I know we can meet this vision of a more reflective democracy. This vision is what inspired a group of us to start an organization we call Color Pack, which is recruiting and training and supporting candidates of color to win in elected office throughout Oregon. But it's going to take more than Color Pack to meet this vision of a reflective democracy. It's going to take all of us. And what can we do? Well, we can give our time and our money to candidates of color who are running not just to represent their own communities, but to represent all of us. We can gather our friends, our neighbors, our coworkers, whatever, have a conversation through the Oregon Humanities Conversation Project. White folks can join amazing organizations like Standing Up for Racial Justice. But whatever it is, we can and we must speak up when we don't see the rainbow of people that is Portland reflected in our workplaces, on our city council, on our school boards. And we can and we must speak out whenever any racist act happens in this city. And we can and must do all of this beyond the virtual walls of Facebook and the impermanency of Snapchat. We can and we must do this because at our core, we do believe that life, liberty, and the pursuit of happiness belong not just to some of us, but to all of us. That it is everyone's dream and one we can achieve together to live long and prosper. Thank you.
Be sure to go into the Nurses on Board webpage, complete their survey, offer your service, put there what you do, what your passions are, what you bring, and make yourself available and make it possible. Thank you so much.